global shortage of testing kits, severe capacity challenges, and a growing backlog of test results has led to people complaining of waiting for more than 2 weeks for their test results. For the laboratories, it's taking more than 24 hours to process the results from the time of sampling.
As the pandemic spreads, there is increased demand for testing, and therefore each laboratory, NHLS, would have to catch up and match up with the demand that is out there. On the supply side, the supplier or the laboratory relies on supplies for different components of testing to catch up with the testing. So if this is skewed, you then have a situation where there is backlogs.
An urgent solution is needed.
We are monitoring the backlogs very closely within the NHLS, and we are also monitoring the hotspots around the country so that we can direct appropriate amounts of testing kits to the different sites where there is hotspots.
Gauteng Health MEC says the provincial backlogs for COVID-19 test results stand at just over 30,000.
The factors that we have attributed to this backlog is a result of a global phenomenon on the shortage of the testing kits that affects the whole world. As a province, we have taken upon ourselves to enlist a number of assistants, particularly from the private laboratory services, which have given us the opportunity to use their services and use the kits that they have.
For scientists in both the private and public health laboratories, it's critical that they get every single stage of the steps of the process correct.
So the first thing that actually happens is that we receive our specimens through the chute, and then we need to put them onto worksheets. So we need to receive them on the system as well as put them onto worksheets.
Before starting the run, it is very essential for us to spin the plate down in order to ensure that the reagents as well as the DNA molecules combine properly. After a few seconds of spinning down the plate, we will then take it into the real-time instrument to begin the amplification process.
But with a national backlog of over 80,000 COVID-19 tests, the reality is that a failure to deliver a quick diagnostics of the tests could prove fatal for those most vulnerable and susceptible to the devastating impact of the virus. Nozintombi Mia, SABC News, Johannesburg.